Welcome back to Family Medicine in 5. We're going to continue our discussion on obesity. Today we're going to talk about medicines. There are some medicines that can help and some medicines that actually can prevent you from losing weight. And that's the very first thing I do when I have a patient come in and we talk about weight loss. I need to make sure I'm not giving them something that is actually going to keep them from losing weight. A really common one in family medicine is antidepressants. So like medicines like Paxil, Zoloft, Lexapro, Celexa, all of those have been shown to hold on to some of the weight. A medicine we use for birth control, Depo-Provera, the injection, often we'll see patients gain weight. And even something as simple as propranolol, which is a blood pressure medicine, we'll see patients gain a little bit of weight on that medicine. There are medicines that can help lose weight. So with depression, I first try and put patient on something called Wellbutrin or maybe Effexor or Pristiq. Those may help them on their weight journey and still control their mood. When we choose a weight loss medicine, we're going to try and choose it based on your comorbidities, meaning the other disease states you have. Are you diabetic or pre-diabetic? Do you have high blood pressure or heart disease? And then we talk about cost, preference, and side effects. First medicine I want to throw in there is metformin. Metformin is actually not considered a weight loss medicine. However, if a patient is pre-diabetic or they're high risk for diabetes, it's a really great choice. There's one study that showed that metformin patients lost 13 pounds over 6 months, and that would help all diabetes. As we talk about weight loss medicines, remember that none of them are covered by insurance. There are some special cases, but for most part, it's self-pay, and so it can be really significant. The first medicine that has the highest amount of weight loss is actually in a class called GLP-1s. The medicines in this class are SAXENDA and WEGOVY. These are diabetic medicines. One is actually Victoza and the other one is Ozempic. They're the exact same medicines as the ones for diabetes, except for they're remarketed and rebranded and they have higher doses as well. How it works is it mimics a hormone in the brain that actually regulates appetite and food intake. These are injections that you give either once a day or once a week. The 68-week trials show that the patients lost 14% of their weight loss, which is significant. But patients often were nauseated, there was vomiting, diarrhea, and this is dose dependent. As the dose starts to push up, so do the side effects. I do find in clinic that when patients don't eat as well, like a lot of carbohydrates and sugar, they often have more of the GI side effects. There has been cases of pancreatitis with it. The cost for this medicine is up to $1,200 a month, so pretty significant. The second medicine I want to talk about is Orlistat. Orlistat is marketed over the counter as Ali. It is the exact same medicine except for it's a higher dose with prescription. This has the longest safety data attached to it, up to 4 years. In their 3-year study, patients lost 7% of their body weight. How it works is it stops fat from digesting and you actually just travels all the way through the GI tract and you poop the fat out. And so that's where a lot of the side effects come from. Patients will get cramping and gas, stool leaking, and oily spotting. So most of my patients do not tolerate this medicine. Because it decreases fat absorption, we see that there's a decrease in fat-soluble vitamins. So like D, E, A, and K will decrease. The cost of this medicine is about $650 a month. Qsymia is the first of 2 combo medicines I want to talk about. Qsymia is actually made of phentermine and topiramate. Over 1 year, the patients lost about 9% of their body weight. They extended the trial for an additional year and they didn't see any further weight loss, and that's the phentermine, which we'll talk about a little bit later on. The side effects are dry mouth, constipation, insomnia, and cognitive dysfunction, which we see with the topiramate a lot. I personally have tried this medicine and I could not deal with the cognitive dysfunction, the memory loss. You just couldn't put things together. And for some folks it's significant, but others it's not. The cost of this one is about $195 a month. The second combo medicine is called Contrave. It's bupropion, which is Wellbutrin, and naltrexone. I love the thought of this medicine. So Wellbutrin works in the brain in dopamine. It's the pleasure receptor. It's released when we do wonderful things. So to say, I'm going to put you get on a medicine that's going to improve your dopamine, and then naltrexone, which we use for addiction. So patients that with like alcohol addiction or even porn addiction will use naltrexone sometimes. So think of that about that as maybe I have an addiction to food, but I still want that patient to feel good. So the thought of it works really great, except for study-wise, patients only lost about 5% of their body weight, and they had nausea, headaches, and even constipation with it. It costs about $150 a month. So let's talk about phentermine. Phentermine is cheap. It was the very first approved medicine for weight, and it was approved in 1959, and it only had one study to back it up, and the FDA approved it anyway. The most recent 12-week trial showed that patients lost about 16 pounds in that few months, but it's a stimulant. So it increases your heart rate, it increases blood pressure, patients won't sleep as well, they'll have dry mouth and constipation, but it's cheap. It's about $12 a month. The reason I use a lot of phentermine because it's cheap, but I don't love phentermine. I do see that patients actually will gain all of their weight back after they discontinue the medicine because the body becomes adjusted to it, it becomes used to it. And so as they start to lose weight, it will plateau out no matter how much we raise that dose. And then when they discontinue it, they just bounce back up. And it makes this cycle like this, which is so bad for the body. We want you to slowly lose it and keep it there. I will use phentermine if I want to kickstart things for a patient who's working really hard, or if cost is so prohibitive, but it's not my favorite medicine. The last medicine I want to talk about is actually called Plenity, and it isn't even really a medicine. It's a hydrogel, and so it's considered a medical device. It is this little pill that actually expands in your stomach and fills your stomach so that you feel like you're full. You take it twice a day, about a half hour before your meals, and it's not absorbed, it's just eliminated straight through in the feces. And in a 24-week trial, patients lost about 6% of their body weight. This is about $100 a month, $98 a month. So those are a few medicines that can maybe help you lose weight. Remember, all of these are tools, whether it's a medicine, diet plan, exercise plan, all of these have to be used together for you to help reach your goal weight. And really, it's a lifetime journey. I don't love fad diets, and that's one of the reasons why patients often gain all the weight back, which is super discouraging. It's more about using all of these tools to help you live a healthier life. Thanks for watching.